Hi, I'm Humaira Sarfraz. I am one of the second-year hematology oncology fellows at Moffitt Cancer Center.
And I'm Dr. Muzaffar. I was working as an associate professor at Moffitt Cancer Center, and now I have moved to Duke University, and I am a head and neck oncologist.
And here we are at ASCO 2023 presenting our exciting study results from a phase 2 non-randomized study looking at safety and efficacy of time-restricted eating in improving responses to immunotherapy in patients with relapsed refractory head and neck cancer. So what we know is that this patient population subset has really poor outcomes. So what we are looking at is what are the modes in which we can actually aim to improve these outcomes. And we're looking at fasting times of 14 hours and looking at two arms, 28 patients in our non-time restricted eating arm and 15 patients in our time restricted eating arm. And what we found with a phase 1 or 2 study is that feasibility and safety wise, none of our patients dropped out. None of our patients actually experienced any sort of side effects with dizziness or hypoglycemia episodes. Obviously, we excluded patients who had diabetes or metabolic syndrome. But what we interestingly found was that the efficacy outcomes, the progression-free survival, was much better in the patients who got the time-restricted eating arm compared to the ones which did not. And same goes for our overall response rate and disease control rate, 64% versus 39%. And then we also found some metabolites here with lower levels of IGF-1 levels and the indole acid and short-chain fatty acid levels in patients who were responders.
So our goal was to look at how fasting affected some of these metabolites with time-restricted eating. So we have the baseline in those who took the fasting at 3 months, and here between those who were fasting and those who did not. And what we did see, there is a distinct pattern of metabolite changes in non-fasting versus fasting. And we had these whole panel of metabolites that were different due to the fasting. And when we look at it more closely, what we see is that tryptophan is an important component of the response, and this was different in responders and non-responders, even those who did time-restricted eating. Look at some of the other metabolites components, we see a clear difference in this heat map. Looking at some of the other stuff, we find that insulin growth factor was one of the main contributors of the difference in survival and response in the patients who did time-restricted eating. And we also saw changes in butyric acid and one of the short-chain fatty acids, which is associated with better responses in patients who have lower levels of butyric acid. So this is just a small study. We want to replicate it in bigger populations of all cancer patients because something that is easy to do and without any toxicity.
Absolutely, and I think that will be our next step and taking it over to other cancers. And then I think in particular going from the lab and translating this research actually into the clinical setting. I think Dr. Jose Conejo Garcia and his lab and his research with the IGF-1 particularly, and then translating it into how it modulates immune responses is a fantastic stepping stone for us. So thanks to him and all of our team members. Thank you.